My name is Chidima Grace Salvagen Eze. I'm going to do a presentation today on the roles and responsibilities of a registered nurse. This presentation is bordered around several subtopics which include the following: a discussion of the recent changes and their impact on the roles and responsibilities of a registered nurse, a discussion on the role of the Nursing and Midwifery Council in relation to nursing practice, an analysis of the implications of the code on nursing practice and the role of the registered nurse, an explanation of the need for effective communication in a multidisciplinary healthcare setting, finally, an evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting, the positives, the limitations, and the effectiveness of the multidisciplinary approach to nursing practice. Moving forward, who is a nurse? A closer look at these superheroes in scrubs tells you that nurses are the heartbeat of healthcare industry. Nursing is a profession within the healthcare sector focused on the care of individuals, their families, communities, so they may attain, maintain, or recover optimal health and quality of life. Who is a registered nurse? A registered nurse is a licensed medical healthcare professional who cares for patients in various settings as part of a patient's medical team. Some of their responsibilities are monitoring patients' health and recording their symptoms and medical history, performing physical examinations and diagnostic tests, administering medical and treatment as prescribed by doctors, educating patients and their families on how to manage their health conditions and prevent complications, consulting with other healthcare providers to coordinate care plans and interventions. All registered nurses are, once qualified, registered with the NMC, that's the Nursing and Midwifery Council, and are named on the register. The NMC sets standards for education, training, conduct, and performance that ensures high quality care and public safety. Registered nurses can work in different settings such as hospitals, clinics, nursing homes, schools, or healthcare. They may also specialize in certain areas such as pediatrics, oncology, critical care, or mental health, patient and family education monitoring, patient response, and documenting drug effects. A registered nurse is a teacher. A registered nurse is a leader. A registered nurse is a team member. A registered nurse is a communicator. A registered nurse is a care provider. A registered nurse can also be a client advocate. A discussion of the recent changes and their impact on the roles and responsibilities of a registered nurse. Since the beginning of the National Health Service in 1948, there has been a significant shift in the functions and duties performed by registered nurses. In the past, nurses were considered to be nothing more than aides or assistants for doctors, but these days nurses are considered to be healthcare professionals in their own rights. Now, because registered nurses now have to handle a great volume of work than in the past, which in turn can affect and can affect on the level of care that is provided to patients, the government has created a new position known as the nursing associates to help relieve some of the pressure that is placed on registered nurses and to assist with care that is provided to patients. The transition to a more professional status for registered nurses has resulted in the broadening of their scope of practice as well as the opportunity to assume administrative duties. They are no longer limited to merely having fundamental capabilities, but rather also have the ability to specialize in certain areas such as accident and emergency care, This results in an improvement in patient care because nurses are able to provide care that is more specialized, informed, and skilled, which in turn ensures that patient requirements are properly satisfied. A discussion of the role of the Nursing and Midwifery Council in relation to nursing practice. In the United Kingdom, nurses and midwives are governed by a professional organization called the Nursing and Midwifery Council, NMC, which also acts as a representative body. It is required by law to maintain and oversee the register of nursing and midwifery professionals. The NMC is responsible for establishing standards, maintaining a register, ensuring the quality of education, and investigating complaints. The NMC offers recommendations and directions, does research, and writes reports on topics that are pertinent to the work that it does. In addition to this, the NMC offers guidance on nursing-related strategy, policy, and education, and it offers assistance in the ongoing development and implementation of the education and practice standards, as well as the code of conduct, which together regulate the practice of nurses and midwives across the United Kingdom, as well as nursing associates in England. Going forward, an analysis of the implications of the code on nursing practice and the role of the registered nurse. NMC sets professional standards apply to all licensed nurses and midwives, whether providing direct care or not. Nurses and midwives must follow these code standards. The values and principles set out in the code can be applied in a range of practice settings, but they are not negotiable or discretionary. This can be found in the NMC Code Book of 2018. The NMC set the code, but the public and patients expect all health professionals to meet these requirements. Nurses and midwives must uphold this criteria while on the register or if they are being revalidated. Failure to do so may result in harsh penalties and NMC action, including removal from the register. The code uses 4 themes. The NMC code is known widely of its 4 themes, which is 1. Practice effectively. As a registered nurse, it is expected that you practice your profession. The NMC code sets the code, but the public and patients expect all health professionals to meet these requirements. Nurses and midwives must uphold this criteria while on the register or if they are being revalidated. Failure to do so may result in harsh penalties and NMC action, including removal from the register. The code uses 4 themes, which is practice effectively. 2. Preserve safety. 3. Promote professionalism and trust. 4. Prioritize people. Nurses must adhere to both professional standards and clinical governance. Nurses must undergo clinical audits to assess their performance against professional standards. These clinical audits indicate nurses where they are meeting professional standards and where they may improve, which is shared with the public. Nurses support patient autonomy, which lets patients make health decisions. Encouragement to participate in health decisions leads to agreement or disagreement with therapy. Going forward, an explanation of the need for effective communication in a multidisciplinary healthcare setting. When it comes to providing healthcare, having clear and effective lines of communication is of utmost importance. Without it, there would be a decline in the overall quality of healthcare. Both the financial burden of healthcare and the number of unsatisfactory results for patients would rise. Effective communication in a healthcare setting requires various factors to come together, including healthcare knowledge, cultural competencies, and the ability to overcome language difficulties. In the event that even a single one of these components is impaired, there will be no communication that is clear and understandable. Patients and healthcare systems need to be able to communicate in both directions for it to be considered effective. However, in order to ensure that the proper care recommendations are carried out, all parties need to communicate clearly with one another. By one, communication occurs in both directions in relation to the interaction between the patient and the system. Two, patients are expected to be able to provide healthcare professionals with information regarding their health concerns and complaints. Three, in order to provide effective treatment for health issues, workers in the healthcare industry need to be able to absorb and understand the information adequately. An evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. You have the positives, the limitations, and effectiveness of the multidisciplinary approach to nursing practice. Now, a multidisciplinary care team is a group of medical experts such as nurses, dietitians, primary doctors, and other staff members who collaborate to provide patients with high quality care that is also coordinated. In many cases, members of staff from all levels of the treatment pyramid are included on the multidisciplinary team. These members may include aides, nurses, physician assistants, physical therapists, social workers, anesthesiologists, and attending doctors. The management of care is accomplished more efficiently by these teams. Every member of the interdisciplinary medical staff is accountable for the delivery of care or treatment in the specialized area in which they have expertise. When it comes to providing high quality care, a multidisciplinary team is comprised of a variety of health specialists coming from one or more organizations and working together. The provision of care that is supported by evidence relies heavily on the expertise of medical practitioners, nurses, and other healthcare workers. If they all work together towards the same goal, the patient will be able to adhere to the care plan that ensures that everyone is on the same page. The majority of multidisciplinary teams will delegate a key member to each patient. This member's primary responsibility will be to serve as the patient's primary point of contact with the rest of the team. Now, the positives regarding the patients: an improvement in the patient's overall outcomes when they were treated by the multidisciplinary care team, easier access to various forms of medical data, an increase in the level of patient satisfaction, enhanced medical care and improved patient outcomes, the shortened amount of time between diagnosis and treatments, the likelihood of receiving care that is in accordance with the principles of clinical practice and includes psychological support. For medical practitioners, the positives, that is the advantages, are also an increase in the level of care coordination, more favorable results for the patients, the simplification of treatment roads, and the elimination of unnecessary service duplication, increased educational possibilities for professionals in the healthcare field. However, there are limitations. These limitations, in the context of healthcare, the multidisciplinary approach has a number of drawbacks, which include the following: the need for additional examinations and inadequate pathology reports, both of which can delay and impede the formulation of therapy recommendations for the joints; barriers of a psychological nature, such as professional silos, hierarchies, and power differentials, can interfere with communication and collaboration between members of the team. Also, limitations can be the presence of organizational hurdles, such as distributed teams, hybrid working methods, and resource limits, which make it difficult for a team to coordinate its efforts and function effectively. Effectiveness of the multidisciplinary approach to nursing practice. The use of a multidisciplinary approach in nursing practice entails the provision of comprehensive care that encompasses several dimensions of a patient's well-being, encompassing physical, mental, and social components. The process entails the collaboration of many healthcare and caregiving experts who collaborate to strategize and synchronize the provision of individuals' care. One of the advantages associated with these techniques is an increased level of patient satisfaction with the treatments, enhanced financial outcomes. There has been a decline observed in the mean length of hospital stays. There has been a notable decrease in the quantity of unscheduled hospital appointments. Also, reduced stress levels among the workers. A comprehensive comprehension of the contributions, duties, and accountabilities of each individual members within the team. I believe that these are the roles and responsibilities of a registered nurse. Thank you very much.